All righty, we are on chapter numero dos of the Lifespan book. And this chapter is going to talk about genetics, epigenetics, and the brain. So it's going to be pretty straightforward, but I'm going to throw in some professional things that these different concepts apply to as we go through here. So slide number 2, learning objectives, describe genetic, epigenetic processes and development and the co-action of heredity in the environment and mutually influencing development, identifying cause-effect relationships between factors that influence atypical development and consequential outcomes, describe prenatal and early postnatal brain development, including brain structures and neuron structures and functions, and explain the central role of the brain in mediating stress-induced adaptations and recognize correlations between allostatic overload and the effects of subsequent epigenetic alterations. So nature-nurture illusion. So if you watched my chapter 1 lecture, I talked a little bit about nature-nurture biopsychosocial factors. And as I stated, both heredity and environment influence human development. I mean, how could they not, right? They both have an effect on the way we view the world, the way we experience the world, how we perceive the world. Helpers need to avoid a one-sided perspective. Who are helpers? Us, therapists, right? Having a one-sided perspective might make us miss an aspect of a person's development, which could be a key to psychodynamic therapy or psychoanalytic therapy, or purely just in narrative therapy. I mean, really any kind of therapy, it could prevent you from seeing an aspect of a person's life or helping a person see an aspect of their life that could be influencing present functioning, right? So recognizing that someone had an absent mother throughout most of their childhood or absent caregiver throughout much of their childhood perhaps has trust issues in people. And that's a nurture issue, right? And so if you don't pay attention to that piece, you might never help that patient unlock their ability to trust others and stop, I guess, what's the word I'm looking for? Punishing other people for mom's sins, if you will. So avoid oversimplification. Genes do nothing without environmental input. Environmental effects are shaped by genetic constraints. It's important to understand the complex interplay of heredity and environment and physical and behavioral outcomes. So epigenesis and coaction. So trait inheritance begins with conception. Ovum with 23 chromosomes and sperm with 23 chromosomes. The fertilized ovum is a zygote with 23 pairs of chromosomes and 22 matched pairs plus sex chromosomes in that 23rd pair. The male karyotype with XY and the female karyotype with XX. With epigenesis, this is processes by which factors outside hereditary material influence how hereditary material functions. There is a gene environment coaction where they always act together. So co means together, right? Each influencing the other. So the cell is the scene of the action. Each cell contains self-reproducing chromosomes made of DNA. Genes are functional coded sections of the DNA, and the matched pairs have half from mom and half from dad and provide that code for each cell to produce a protein. Gene regulation or gene expression is at the center of coaction. It involves transcription, translation, and transcription factors. These transcription factors bind with portions of DNA to begin the mRNA production. And these binder receptors located either inside or outside the cell. So the DNA becomes the template for mRNA through transcription, and then the cell reads it and produces a protoprotein through translation. And so, of course, if you watched my first video, you know I like visuals. So DNA is your gene containing information, and then through transcription, there's a regulation process, and you've got RNA, right? Post-transcriptional control takes place, and you got translation regulation. And then proteins regulate and control to produce gene expression traits and cell function. Now using a little bit more of a zoomed out view, right? You've got your cell here, and you've got your nucleus with your DNA, your exon, your intron, the transcription, the RNA splicing, the exportation of the mRNA to translate into a protein. So the side here says it's a figure from nature.com. Overview of the flow of information from DNA to protein in a eukaryote. First, both coding and non-coding regions of DNA are transcribed into mRNA. Some regions are removed during the initial processing. The remaining exons are then spliced together, and the spliced mRNA molecule is prepared for export out of the nucleus through addition of an end cap sphere and a poly A tail. Once in the cytoplasm, which is this outer piece here, this light blue, the mRNA can be used to construct a protein. Gene regulation. So bidirectional processes, cells' chemical makeup directs activity of genes, and genes affect chemical makeup of the cell. Epigenetic changes affect gene transcription. So methylation and deacetylation reduce gene transcription, all these big words, and demethylation and acetylation increase transcription. Explanation for discordant physical and behavioral characteristics in monozygotic twins with identical heredity. They have the same genotype, but different phenotypes. So more about genes. For alleles, they're slightly different forms of the same gene. They provide different messages to the cell. There's a dominant recessive relationship, so one overpowers the other. The carrier may not exhibit the recessive trait, but phenotype of offspring may, if other parent is also a carrier. There's codominance with some alleles, so one type A blood allele and one type B blend as AB type blood. And then polygenic effects is where traits influenced by protein products of different gene pairs. For typical development, there's continuous progress from single fertilized cell to differentiated organism. There's a period of the zygote of 2 weeks from fertilization to implantation into the uterus. The period of the embryo is the 3rd to the 8th weeks, and the formation of the organ systems and structures starts to happen for the baby at that point. And then the period of fetus is from the 9th week to birth, and the reproductive system forms, and brain and nervous systems continue to develop. As for atypical development, and those are usually a result of deviation in the genome or environment of the developing organism, right? So did mom fall down the stairs? Is she using drugs or alcohol? Is there a lot of stress in the environment of the developing fetus's parent, the mother? In terms of recessive defective alleles, they can cause sickle cell anemia, cystic fibrosis, hemophilia, and others. Both parents are typically carriers of a defective allele, and the child gets the recessive from both. Dominant defective alleles that come from heredity or mutation can be a parent carrier, resulting in having one parent that's a carrier, but there's only a 50% chance that they'll get that gene, like Huntington's disease is an example of that. And epigenetic effects can prevent transcription of defective alleles. Chromosomal abnormalities, they do have an influence. So a zygote forming with too many or too few chromosomes, either mother or father may be that source, and it can increase, the odds of that happening increase with the age of either parent. So if a mother has what's called a geriatric pregnancy, which I think believes starting at the age of 36, when a woman is pregnant, it's considered a geriatric pregnancy. The chances go up for developmental issues in a fetus. So a common example is Down syndrome, also trisomy 21 referred to. Extra copy of the chromosome 21, usually from the ovum, and it results in intellectual impairment, distinctive physical characteristics, and heart problems. Teratogenic influences, or teratogenic influences, excuse me. Teratogens, environmental substances or agents that can harm developing fetus and cause epigenetic modifications to DNA. Alcohol, maternal drinking affects 2 to 5% of US born babies. Fetal alcohol spectrum disorders, fetal alcohol syndrome. Variable effects, there's a variation of effects that can be from none to many. So a fetus that has been affected by alcohol can have learning disabilities, brain abnormalities, hyperactivity, unique facial characteristics, and more. Timing of drinking affects the damage that's done to the fetus. You're most vulnerable to damaging a developing baby in the first trimester, and it's more prevalent among boys than girls. Dosage of alcohol does affect the damage done, and binge drinking is especially harmful. So how does this apply to being a therapist, right? If you've got a female patient that is pregnant and that struggles with alcoholism, this is really good information to educate your patient on, and you can use it within motivational interviewing, which you may not know about that, or you may already, but motivational interviewing is basically asking questions to motivate someone to change unhealthy or harmful behavior. So you could be asking questions like, do you want a baby that has learning disabilities? Do you want a baby that struggles with mental stability? Do you want a baby with deformation on its body, on its brain, on its face? Right. And so education like this could be something that could really motivate a patient to stop using. And, you know, I even saw it. I used to work at the probation department here in Houston, Harris County, and I worked in a specialty court for DWI offenders. And I remember specifically there was a woman in one of the courts that was 3 months pregnant. And in this program, the probationers had to stay sober. And if they didn't, they could get community service time or jail time on the weekend, just depending on the number of offenses that they violated. And this one particular woman, the judge told her, if you drink a single time during this probation, you test positive once for alcohol or any other drugs, I will put you in jail for the rest of your probation sentence. There will be no arguing about it, because for the sake of that baby and keeping it safe, I will not tolerate you having any usage in this program. And that scared straight method actually helped that woman stay sober the entire time. Right. So you can see implications in the court setting. You can see implications in the private practice setting, or if you're working inpatient with someone going through detox, you want them to know these things. And even if you've got a young lady that wants to have kids in the future that's struggling with alcoholism, you could educate, well, we want to get this under control so that when you do have a baby, you're not putting your child at risk for these different issues, right? There is a chart of common teratogens and their effects in the book, and there's a greater number of risks. When there's a greater number of risks, that means there's a greater chance for negative effects. Nutritional influences, so negative effects of poor nutrition during prenatal and early postnatal development can compromise the physical, socio-emotional, intellectual development of a fetus. It can also have long-term behavioral consequences like inadequate iron leading to anemia. Infant exposure to famine can also have lifelong effects and likely can result from epigenetic changes at a cellular level. So you can also develop kwashiorkor, I think that's how you say that, with stunted growth or protuberant, I think that's supposed to say belly there, extreme apathy where you just don't care about things, and cognitive impairments altered by nutritional influences or altered by the presence or absence of other risk or protective factors. So do you have a loving, supportive home or not? Are you in a safe environment or not? Are you in a third world country or not? Are you impoverished or not? Do you have access to food where you are? Do you have to hunt for it yourself, right? And so if anyone doesn't know what kwashiorkor is, it's caused by an inadequate amount of proteins in the body and usually found in countries where good food is not readily available. So it's that classic, not classic, I shouldn't have said that word. It's that commonly known pot belly that you see in children that are very malnourished. I think UNICEF commercials often show children that need your donation today, right? That's resultant of malnutrition. The developing brain. So the neural tube forms in a 2-week-old embryo. Neurons form and they become building blocks of the brain. Major brain structures form: the hindbrain, midbrain, forebrain, with the medulla, pons, cerebellum, reticular formation in the hindbrain. And these things all regulate the autonomic function. So the things that happen without us having to think about it. The midbrain involves the superior colliculi, inferior colliculi, and substantia nigra. These things receive sensory input in the forms of vision, hearing, and your consciousness. And then lastly, your forebrain has your cerebrum, thalamus, hypothalamus, and limbic system. And what the forebrain does is it receives and sends messages, regulates bodily functions, language, emotion, learning, memory, and more. Another image. So your frontal lobe is where your problem solving, emotional traits, reasoning, judgment, speaking, voluntary motor activity happen. Temporal lobe, understanding language, behavior, memory, and hearing. Your brainstem is where breathing, body temperature, digestion, alertness, sleep, swallowing are controlled. Your cerebellum base of your brain involves balance, coordination, control of voluntary movements, and fine muscle control. Your occipital lobe is vision, color perception, and then your parietal lobe is knowing left from right, sensation, reading, and body orientation. Now, why does this matter for being a therapist? Bringing it back to that. So people using drugs and alcohol are inhibiting their brain function. So people that are in fight or flight mode, their frontal lobe is impaired because you are focused on survival. So when, I don't know if anybody that's watching this has ever been so angry to the point that they can't think straight. They just need a minute, right? So fun fact about the brain, when you go into fight or flight response, well, there's other different views: fight, flight, freeze, appease. I can explain more about that in a minute, but whenever you're in fight or flight mode and you're in survival mode, excess blood in the brain goes down into your muscles to prepare you to either run or defend yourself. As a result of that, what do you think happens to your thinking? Becomes clouded. And how good of a decision, how good do you think you're going to be at decision making if your thinking is clouded? Not as good as you could be, right? And so knowing this different kind of stuff can really help you with educating patients on why it's important to control anger, why it's important to control anxiety and depression, why it's important for a person to have sobriety to be able to make good decisions and have clear decision-making processes. Also, you might run into having some patients with what are called in shorthand TBIs, traumatic brain injuries. If you know exactly where a person's brain injury is, you can understand the nature of why they're having whatever issues they're having, right? So if a person has a traumatic brain injury to the front and they're having a lot of impulsivity and recklessness issues, and they're making a lot of bad decisions and spending a lot of money, and they're being just reckless with their life, that would make a lot of sense because their reasoning, judgment, and problem solving skills are in their prefrontal cortex, in that frontal lobe, right? So knowing the parts of the brain and what they do, and if you have a patient with a traumatic brain injury, substance use disorder, or you could even get somebody that has a cyst on their brain, which can leach off of them or inhibit the functioning of particular lobes depending on where it's at, right? So if they have a cyst in the parietal lobe, that could affect things a certain way. If they have a cyst in the occipital lobe, that could affect things in a certain way. I had a client that had a cyst on the back of their head, and it caused for symptoms that would make you think that that client had autism, oppositional defiant disorder, social anxiety, anger management issues, bipolar disorder. It just caused presentation of a lot of symptoms that weren't there until the cyst had manifested to the size that it was when it was found on scan. So knowing the different functions of the different lobes is really important. And it can also help you with referral of a patient to go see a neurologist and get a brain scan, because maybe there is a cyst in there causing malbehavior in a child or an adult or an adolescent, right? Or if they had that traumatic brain injury, hey, go get checked. I want to see if this might be something you think you maybe didn't get a traumatic brain injury from your car accident, but it'd be good to get checked, right? So next, structure and function of neurons. Neurons vary in size and shape. Neuron structure and functions. The axon is a long extension from a neuron and transmits impulses. Dendrites are short extensions and they receive impulses. Neurotransmitter carry messages, transmitters carry messages to the next cells. Myelination promotes efficient conduction of impulses. So rapid neuron reproduction continues in the first year. The developing fetus, some neurons reproduce even in adulthood, most do not. The formation of synapses is ongoing. Later, prenatal brain development, the 4th month of gestation, neurons begin firing. Soon, sense organs develop sufficiently to respond to perceptual stimulation. They can recognize mom's voice. They know what it sounds like, and they can attend to and discriminate cadence of rhyme. So you see those things in movies or TV shows where women put the headphones on their belly and they're playing music for the baby, right? They can make sense of that at month 4. At the 25th week, babies can open and close their eyes, turn their head towards a light source, and sensory systems, auditory and visual, influence each other. They can integrate these symptoms to make sense of the world. Postnatal development, neurons reproduce at a rapid rate and slow after 1 year of age. Synaptogenesis simultaneously occurs with new synapses. A sign of amount of learning occurs. Overproduction of synapses also occurs. Neural pruning. Many neurons die and synaptic connections are selectively discarded based on need use. So that's a really getting late, important piece of information, neural pruning. So in addiction, the limbic system, which is along the ears, along the side of the head, is where the reward pathways are in the brain. And I very often use neural pruning as a means of motivating my people struggling with addiction to work on it, because using an example, let's say I love basketball. I played volleyball in college, but let's say I love basketball. And the first time I played basketball, oh my gosh, it is just so much fun. I'm having such a great time hooping. Y'all look at me. Okay, LeBron over here, King James, whatever. If you even like him, maybe you don't, I don't know. But let's say I'm LeBron James. I'm really good, right? I think I'm that good. And I love it. I have so much fun. I only played for an hour. The next time I play basketball, I'm going to want to play it longer because I want to get more pleasure from it. Playing an hour just isn't enough anymore. And so using my handy dandy dry erase board once again, I am creating a pathway between basketball and pleasure, right? So the more times I access that pathway, the wider it's going to get, and the more basketball I need to play to feel happy, right? And so the same thing, and if you can't see that, it's basketball with the path there. The same thing runs true for things that people get addicted to, right? So the more I access a pathway, the more of it I need. The more alcohol I drink, the more alcohol I need in order to get the desired positive effect, right? But what happens when I stop playing basketball? Over time, the less I play, the less I need to play in order to get that desired positive effect, right? So my neuro pathway becomes smaller. And if I stop accessing it altogether, I lose that neuro pathway, and my brain forgets that basketball is a connection to happiness, and away it goes. So use it, you lose it, right? And so what I help people that are struggling with addictive behaviors to understand is that and it's 90 days to rework the neuro pathways in your brain, get it fresh cleanse. The person using alcohol, for example, if they stop drinking alcohol after 90 days, that neuro pathway is going to go away, and those cravings and urges that come with it, gone. But what's important is you have to make sure you find an alternative replacement, something, because if you don't, your brain's gonna be like, oh my gosh, we're bored, we're not stimulated, we want something to do. What is familiar to your brain memory wise? Oh, we know alcohol works, we'll just go drink. No, you got to find a replacement activity and behavior to be able to prevent relapsing back into that alcohol use behavior, right? So neural pruning is a very real thing, very active, very applicable to counseling. Experience expectant. Synaptic growth is based on experience, common to all humans, and experience dependent. Synaptic growth is based on individuals' unique events. Is synaptic growth that's based on individual unique events and experience. The developing stress and adaptation system. So stress, body's adaptation to response, adaptation response to demands and challenges. There's good stress, tolerable stress, and toxic stress. So another term for good stress is eustress, eustress, eustress. Good stress from good things. Like I got a new job and it's stressing me out trying to figure out how to do it. I just got married and I'm learning how to cope with having a spouse. I just had a baby and I'm learning to adapt to the baby's schedule. These are all good things that are happening, but there is stress associated. And then tolerable stress is your day-to-day kind of stuff, like, okay, I'm dealing with traffic and, whatever. And then toxic stress is I'm in an abusive relationship, Toxic stress perhaps is I've got failing health, but I'm not taking care of it. And I'm burning out at work, right? Toxic stress, not good for you. So allostasis is the regulation of bodily processes that adapt to stress. Allostatic load is the cumulative cost of these adjustments, and the allostatic overload is the pathological changes that are a result of toxic stress. So the amygdala starts the stress response through sympathetic nervous system and hypothalamic pituitary adrenal axis, HPA. Parasympathetic nervous system returns systems to normal. So toxic stress and allostatic overload. So intense chronic stress creates allostatic overload, and this has the potential to alter physical and psychological functions, and your stress response becomes less efficient. So as I was mentioning earlier, or maybe it was in the last video, I can't keep it straight. I'm recording them in the same day. If someone is in a toxic environment, it would not be very helpful to them to be crying all the time, right? And the brain and body, like I said earlier, it likes to survive. So what do you think it's going to do in an extremely stressful situation? It's going to crank down the stress response to be able to keep your system from being overloaded and sick and unhealthy and burnt out and shut down, right? So intense chronic stress, your stress response can become less effective, less efficient because it's getting shut down, because it's like, well, this is my normal, so I just need to deal with it. Instead of being upset about it or recognizing that it is stress, I'm just going to normalize it and it's fine. And you can see how this intense chronic stress might lead to someone that's been in one abusive relationship to keep going into abusive relationships because they normalize it. They don't see it as a problem. It's comfortable. It's what they're used to, right? Effects on the immune system. Oof. So inflammation persists and revamps the immune system. So when you are really stressed, that causes inflammation. For someone with an autoimmune disorder, that could mean severe joint pain. Chronic stress increases your risk for cardiovascular disease, type 2 diabetes, and other illnesses like lupus, rheumatoid arthritis, fibromyalgia, gout potentially. Stress can alter brain development in a fetus, stress in the mother, and early adverse experiences contribute to later illness by altering allostatic regulation, which interfere with development. So what are early adverse experiences? What does that mean? What are those? So that would be traumas of different kinds. It could be parents going to prison. It could be sexual abuse. It could be neglect. It could be having a parent in the household that's an addict. It could be seeing domestic violence in your home, seeing mom hit dad or dad hit mom, or dad hit dad or mom hit mom. It could be someone in the household just having severe mental illness, schizophrenia, bipolar disorder, I already said substance use issues, bipolar disorder with rapid mood swings, cyclothymic, where it's very, very fast, rapid changing, or even a parent with a personality disorder, like having a mom or a dad with borderline personality traits or narcissistic personality traits, could have major impact on a child's experience of growing up in a home and cause stress. So lastly, applications. So loving care reduces children's risks during development. Maternal depression from preconception through postpartum period influences children's development. Treatments can serve as prevention for infants, and stress can trigger affective disorders during pregnancy. So emotional expression. Healthy baby guidelines promote healthy prenatal development, and preterm and low birth weight babies, for them, the power of touch enhances their development, right? So I don't know if anyone's ever watched Grey's Anatomy. You see the episode where Alex, one of the doctors, takes his shirt off and holds a baby to his chest and is able to keep it alive because that skin to skin contact and allowing for it to have that power of touch enhancing its development and ability to survive. Massage also helps increase weight. I'm not totally sure why that is, but I'm sure that the book addresses that. But if it doesn't, my thoughts are It just helps with circulation of the blood and what is in your blood, oxygen, and what helps muscles and everything else be healthy, oxygen, right? And so I would imagine that that massage also helps with the digestive process and just regulation of those things. So that is the end of the PowerPoint. Now for some questions. Okay. Coded sections of DNA that help cells construct the proteins that influence physical and psychological characteristics are called what? Chromosomes, genes, histones, or zygotes? Genes, right? Down syndrome is a common disorder. Which of the following circumstances results in Down syndrome? Defective recessive alleles, defective dominant alleles, insufficient number of chromosomes, or an extra chromosome? A, B, C, or D? Extra chromosome, D. All right, how long can the consequences of prenatal malnutrition affect an individual? Until birth, through infancy, throughout life, or until nutrition is balanced? Which one? Entire life. Significant, their entire life. Which of the following does the body release to help put an end to the stress response? This will come from the book. Cortisol, not epinephrine, not cytokines, not dopamine, cortisol. Okay, which of the following statements is true about the effects of teratogens on the developing fetus? A, usually has the same effect regardless of when in the development exposure occurs. B, the kind of damage done depends on the stage of development during exposure. C, it usually has the same effect regardless of how much exposure the fetus has to that teratogen. Or D, ancient Greeks believe in teratogens, but modern science has been unable to identify any. B, kind of damage done depends on the stage of development during exposure. A couple left here. If you look at the karyotypes of person A and person B and discover that they look alike, what can you infer is the same about these two people? Their parents, sex, height, or blood type? Their sex. All right, last question. Massage therapy for infants has been very successful in promoting weight gain and social interaction and in decreasing distress in low birth weight infants. Based upon developmental research, what is the best explanation for this? A, infants' bodies take in more nutrients when they're touched as they nurse. Touch is the best developed sense at birth and therefore the most effective avenue for soothing and regulating the newborn. C, when the infant is massaged, its attachment to the caregiver is strengthened. Or D, crying and other distress is reduced because the infant is paying attention to the person giving the massage. B, touch is the best developed sense at birth and therefore most effective avenue for soothing and regulating the newborn. So I guess what I had to say was a way off base. I don't know. Maybe there's some truth to what I said. But that is the end of the chapter 2 PowerPoint and questions. I hope that this was useful for you. Feel free to leave some comments or email me if you've got a question. And I hope you have a wonderful evening. Thank you.